It's detailed.
Listening to the events of the late 50s through the 60s.
All my concern, a marriage cannot be anything else but a marriage.
Before a leader rises up, a leader must first be part of the marginalized community.
Accurate and news after news. Coming up is the feature of the day. Radio Patches 94.5 and 101.4 FM. Peace of Christ for all.
Yes, that is the sound that irritates everyone taking any kind of medication or has been taking it for a long period of time. According to UNICEF, Uganda is one of the youngest population in the world, with 44% of its citizens under the age 14 years of age. But unfortunately, this population of young adolescents are being eaten up by HIV virus, a global epidemic disease. Dear audience, my name is District-Komakech, and in this edition of the Radio Patches news feature, we shall look at how unsuppressed viral load among young adolescents in Gulu City is worrying activists and health experts as the country strives to end the spread of HIV by 2030. By definition, unsuppressed viral load refers to a situation where the level of human immunodeficiency virus in an individual's blood is not effectively controlled by antiretroviral therapy or other means. In people living with HIV, antiretroviral therapy is prescribed to suppress the replication of the virus, reduce its presence in the bloodstream, and slow down the progression of the disease. When the patient is adherent to the ART regimen and the treatment is effective, the viral load in their blood should become undetectable or be maintained at a very low level. Therefore, this simply means that we are sitting on a ticking time bomb if the viral load among the sexually active category of people is not reducing. To set the ball rolling, a HIV client recalls her ordeal in dealing with the virus and taking her medication.
My viral load was not suppressing because I had fear that my friends and family should not know that I'm taking HIV medicine and I am HIV positive. But right now, after being cancelled and have much information, and my virus is suppressing.
However, our challenge is also attributed to numbers of factors, as cited by some young adolescent peer supporters in Gulu City.
You find that they are living in an extended family whereby there are so many, and you find the siblings or the blood children, and even the mother is stigmatizing the child, leaving the child away, and the child also thought of, since they're saying I'm now hopeless or helpless, they will just leave their drugs for some times, and there is also increasing the suppression rate, the non-suppressed. The virus is coming high due to also disclosure. You see, this one is mostly among the adolescents. You find I'm a girl, I want to date a boy who is negative, but I'm having HIV, and I'll just, what should I do now? That boy also loves you, but how to tell that boy that I'm having HIV is difficult, and mostly the adolescents are facing this one. That also is hindering their adherence. We have also taught them that we have counseled them when you're going through those things, those challenges. You have not to give up. You have to face the challenge and show to them that you are not somebody who is helpless, who is hopeless. You have to take your drugs well, so that those signs that will show that you are HIV positive will not be there. You have to remove those thoughts in your mind. You have to focus in your drugs, because some of us, we have experienced those things, but now we have grown up, we have even learned, the world is now seeing us, we are not like the second-class people.
The non-suppressed level has been also increased through the issue of divorce. You find the parents separating and the children are not getting a good life. They're staying with one parent, maybe the other parents who is staying with the children are incapable maybe of providing the needs to those children. So you find also very difficult. And then there's some way we are also getting the challenges of non-suppressed and follow-up difficult. That is multiple caregivers, whereby I might be living with my grandmom. At the same time, after 2 weeks, I might be going to see my uncle. I can stay there. My mom is there. I'll go and visit my mom. Maybe even within a month, maybe I've stayed with more than 4 people. But then you find there's only one person who is staying with my drugs. There's only one person who is administering the drugs to me. So you find adhering to my drugs will be very difficult.
But also we've noticed that in schools there are also students, children, young adolescents who are studying. And most of them would be really fearful to disclose their status, which is really hard. And I don't know whether you've been in position to liaise with the matrons, the school authorities, to ensure that yes, they are taking their medication, but not again leaving medication at home. When they're at school, they are not taking anything for 3 months. They're coming back unsuppressed and again sick and sickly.
By now, we have seen some children who are staying in a boarding school, whereby those who are in the boarding school, we always we get attached with the matron and the school nurse. Then we always make sure that they are in the school are actually easy by making sure the drugs stayed with the matron or the school nurse, whereby those children, they will be having an open space for taking their drugs. Not like keeping the drugs inside the dormitory, whereby you'll be hindering yourself and you have those challenges of taking drugs from the dormitory, whereas you'll be thinking of somebody might peep at me, somebody might check into my box, maybe when I'm not around. And then we have some challenges for those who are not accepted for their drugs to be kept. Yes, we have some of those children whereby they are too contented inside them that they can't keep their drugs, whereas they are also facing challenges of taking their medication. In the other way around, by the time they're supposed to take their drugs, you find 2 or more students that are inside the dormitory, and it is very difficult for you to pick your drugs. So you ended up missing your medication. So those are the challenges. Those who have refused to take their drugs to their school nurse, they're facing. And then we have another challenge like poor timekeeping. You find that one is cut across those who are keeping their drugs with the nurse and those who are keeping their drugs in the dormitory. Those people that are facing those challenges, poor timekeeping, whereby the time might pass even with more than 10 minutes or 20 minutes. And that one also contribute to a non-suppressed and really it contribute.
According to a nurse at Gulu Regional Referral Hospital Child and Adolescents Clinic, lack of disclosure is the challenge.
When we talk of lack of disclosure, we always encourage them to disclose to their closest relatives or caretakers so that when they are forgotten about the time of their ARVs, the caretaker or the parent can remind them to take their ARVs, especially when they're in boarding schools, because if they have not disclosed to their closest friend or to the teacher or to the matron, they will not take their ARVs. The one who opt to stay with their drugs, we always tell them to pack it in a small packing envelope. At least we can take her or him for a week. Then later on, they add on to it because in most cases, they fear taking it directly from the tin. 1, it makes noise. 2, everyone will know that this one is taking ARVs. So how do they overcome those stigmas in boarding school? Others, they even tell you, I want my drug to be with this teacher. So if they're comfortable with that teacher, you also tell them, okay, fine, you go and talk to the teacher as a caregiver. You also visit the child in school and find out that the child is taking ARVs well.
Janet Achiro is a child counselor at Taso Gulu.
At Child Center, right now, we have our suppression rate for the non-suppressed children and adolescents. The suppression rate is at 82. Then the balance is now for the non-suppressed 18%, which means there's still a very big gap because when it comes to suppression, even if 1%, that is already a danger sign. And as TASO, what we are trying to do to make sure that we support these children to suppress The